So toothbrushing activities, this is my suggestion. Most of the suggestion that I'll give to my children and the parents. Okay, so first and foremost, when you want to do brushing, you have to get started with the right paraphernalia, with the right equipment. Okay, so getting started, get the right toothbrush. Okay, is it hard bristle? Is it soft bristle? Some of ASD also comes with processing sensory disorders. Okay, where they have a very sensitive, especially the facial part and the lip. Okay, and some of the kids can really have a very sensory issues inside their mouth, especially the non-verbal ones. Okay, when they cannot speak, they cannot function with the tongues. I mean, they have less sensories inside their mouth. You are actually having a little bit challenges, more challenges than the verbal ones, because they cannot, they just don't like textures. Okay, so bristles can be a very intimidating and a very annoying feelings for these groups. Okay, so that's why you definitely have to choose the right brush. Okay, if you go to the markets, to any Watson Guardians, there's an array of full of a stack of apa nama ni, toothbrush with a very different bristles. Now we are actually initially during previously we do have hard, medium and soft. However, nowadays I think in the market I've seen more of the soft bristles rather than the hard bristles, and there's still medium bristles. So try to choose. Perhaps you can buy all three types of bristles, okay, hard, medium, soft, and try first, but not to their tooth directly, but try to their body first, because I do understand some of the parents do practice brushing, use a brush, introduce them to the toothbrush. Okay, so you buy all three toothbrush, for example, you try all three on their body surfaces first, especially on the palm and at the back, at the top of your hands and at the palm. Okay, so try which one that they are actually can bear maybe minimally about 60 seconds. Okay, 1 minute, for example, you can brush along which one that they allow you to play around with their hands, then maybe that's the right brush for them. Then from the hands, you bring to the face. Bring brush to the face first. Okay, if they can tolerate it on their face, then you go slowly to the lip, then later on it goes inside the mouth. It can take up to 1 week or 2 weeks or perhaps 1 month just to introduce the toothbrush, but I think it's something that we have to start. Otherwise, toothbrush won't be something that they like to use. Okay, then you can choose between the manual toothbrush or electronic toothbrush. It depends. Some kids really like the feelings of vibrations. They like this kind of feelings. Then you can use the vibrating toothbrush, okay, the electronic toothbrush, or you can use the manual if they don't like the vibration. Some kids are very sensitive to sounds, even though a very small sounds. So vibrations, electronic toothbrush do produce a little bit of humming sound. So I have to be careful on that. However, my personal practice, I do encourage parents to encourage children to use a manual toothbrush, not only for them to to get them to do it on their own, but to get their hands the the round movement or the vertical movement of the hands, because when you use a manual toothbrush, you definitely have to work so much of your fingers and your hands. So this is also can help the ASD children's to have to build up on their kendiri and to build up on their sensory issues on the hands and their palm grip, because most of them have a pincet grip, like holding a pen. So if they try to use a lot with brush, we can also practice with the hand grip. All right, so next is to get the optimum toothpaste. So this is actually a very straightforward photos. The above toothpaste amount is for the adults. The lower ones, the senior, is under 3 years old. And the over 3 years old, we use a pea size. So this is a very important when we discuss about the amount and about the challenge of spitting the toothpaste. The amount is a very small amount where in my opinion, personally, I don't think it might cause any toxicity, even though you brush your child's brush every day with this right amount of toothpaste. Okay, the possibility that it got swallowed is very minute actually, because if you see the amount of the toothpaste on the toothbrush is such, and when they hits the tooth when it hits the tooth, most of them is going to go on the tooth surface. There's nothing much left actually if the child really wants to swallow it, unless they manage to eat a toothpaste directly from the toothpaste tube. That is something different. Okay, so in my opinion, personally, I don't think we need to be worried about the amount of the toothpaste we used, if you use the right amount for them during the brushing. Okay, so this is something that I very much encourage for the children and for the parents, is a toothbrushing chain. What does it mean by this? Because perhaps your child is not, it's not, it can be somewhere in between these three photos. So for example, patients who are very severe, are very not well cooperated, instead of pushing them brush themselves, we can start with providing the toothbrushing for them first. Okay, so that they just, this is actually a very good practice, where just to introduce the texture and to introduce the activities to them. All right. So it's good if you can do toothbrushing. Just you yourself provide, even though, like for example, your child is already 8 years old or 10 years old. Suddenly they started to doesn't want to do brushing. You can always go back to provide the toothbrushing. It's not only to encourage back the texture and the activities, but it's also at the same time maintain the optimum oral hygiene. So these are the two things that we have to do actually. With brushings, it's not just only for them to practice and then accept toothbrushing, but it's actually the optimum oral health care that we need. So if the child cannot do it themselves, or they are, giving you a little bit of challenge once in a while, we provide. Okay, so perhaps once in a week or during the weekend, whenever you have possible time, just have, you can also play a role play with your child as a dentist and a patient. Okay, you become the operator, you become the dentist, and try to do this kind of activities. Then it really helps us when they comes to our clinics. They are quite actually familiar with what the activities of opening the mouth uh, for us. Okay, so after we provide, and then we move to assisted. All right, because in provide is actually to introduce the textures, to release the sensory issues, and when the times comes that the kids are well enough to start holding the toothbrush and bringing the toothbrush to their mouth, this when the chain started to move to the right side, where it becomes an assisted toothbrushing. Okay, so in these pictures, you do it together still with them, but you are holding their hands when they are actually doing the activities. Okay, until the end, and when it goes move to the right sides, when the patients are now more comfortable to do everything themselves, then this is actually the goal that we want to achieve. So next, coming to the next some of the solutions that I can suggest is actually the toothbrush modifications. This can We can do this, for example, if patients, a toothbrush only have one size of holding, the way that they hold. Okay, some parents, some patients, some children do have a little bit of sensory issues with their hands. They are very difficult to grip, especially hand grip. And most of them have a pincet, like a two-finger grip, like a pen grip, but they are challenged with the hand grip. So these are some of the modifications that I can suggest um, for parents to DIY at home, and then try to elevate the activities. Okay, so the first photo is actually a bicycle handle. Okay, I just bought the bicycle handle from any DIY shops. You put it in and then put some plasticine or some gum gajah to make it stable. I do also encourage to buy the bicycle handles with some of the texture. So these textures can actually, encourage the sensories of their palm, and they can start it to, when they start to feel this texture, it might give them possibility for them to little bit push and brush their teeth. Okay. So the next one is towel, just a towel, a merely simple towel. Towel good morning also can, and then tied it up with the getah, okay, with a rubber band. All right, this is also one of the techniques. If you don't go to the idea is to get the right texture for your child. Okay, perhaps you can start with something very soft first, and then you go to something with texture. For example, you can also go with the tennis ball. Okay, I made a hole in the middle of the tennis ball. And the next two photos is actually a compound. This is like a plasticine material. All right, this is available in our clinic. This is actually a materials that we use to do dentures. Okay, the one of the dentures stages. But the idea is because this material can be moldable using only hot water. So when we put it into the hot water, it starts to become like a plasticine. So we can mold it based on the mold or based on the structure of that we need. So we can actually have the grips of our own children, of the own children, okay, or the way that they want to hold the brush, we can estimate it. All right. Beside from that, you can also use plasticine to make it harder. You blow dry it with the hair dryer to get rid of the water, so the plasticines can become harder. So this also give a same outcome using this compound.